Recording.
Hello, everyone. Hello, everyone. My name is Olajumoke Adebayo. So, just having a little technical problem. Let me just that. Okay. Hello, everyone. Let's start again. My name is Ola Adebayo. So this is the last webinar we'll be having based on our series on the midwifery education webinar. Today's topic is on respectful maternal care. It has been a global discourse for a while, and it's something that is quite important that affects the quality of care that the women we take care of receive, and also influences the outcome of care as well. So I'm just gonna go through this, and if you watch this recording at the end of it, or if you have any questions, please feel free to ask, and I'm happy to respond. So this is like one of my favorite quotes. Listening to women is a radical act, but acting on what we hear is revolutionary. And basically, it's that is what respectful maternal care is basically about. Listening to women and ensuring that what they tell us, we actually believe them. Because a lot of times, people that work with women would say they listen, but they ignore or they dismiss whatever these women say. And I'm sure from my experience as care workers, there are some times that when women tell you something and you actually follow it, you find that the man knows our body better than we do. So it's very important that we actually listen to women when we care for them. It really, really does goes a long way to influence how they perceive the care we give and how they perceive if what they've received, the kind of care they've received has been very good or has been optimal. So, what is respectful maternal care? Respectful maternity care refers to care that is organized for and provided to all women in a manner that maintains their dignity, privacy, and confidentiality. It ensures freedom from harm and mistreatment and enables informed choice and continuous support during labor and childcare. It's not a complicated topic. It's just quite new in the global discourse, which some people might actually know already. And it's basically just providing is what we do, but it's basically us now being more conscious of what we do. It's how I like to perceive it. So ensuring that we provide dignity, ensure that we provide privacy, confidentiality in care, freedom from harm and mistreatment, and then we ensure informed choice and continuous support during labor. So it's something that we're all familiar with and what we are trained to do as healthcare workers. Or the difference now is we just have to be more conscious of it to ensure that we're providing this care adequately. Now, the opposite side to when you do not give respectful maternal care is disrespectful maternal care. And what does that look like? So there are two words in relation to disrespectful maternal care. That's undignified and disrespect. Undignified is when it's lacking dignity or value for someone. So if a woman comes into your care and you don't do things that would make that woman feel like she's valued, or giving care that is undignifying to her, then that's a form of disrespectful maternal care. Now, the other side is disrespect, is when basically disrespecting someone is rude conduct and usually considered to indicate a lack of respect. So when we do not respect our women and we provide care to them, it always shows because we're quite disrespectful to them. So when you, as a healthcare worker, do these things, it can indicate you giving disrespectful maternal care. And like I said earlier, it's something we're all aware about, and it's important for us to know that there are things that are around us that can influence how we work, how we perceive our women that we take care of, also the kind of care that we provide to these women. If we are in a system or a health environment that does not even respect us as care workers, a lot of times we are very prone to providing disrespectful care. And because this is not a respect workshop, so we're not able to address all like the systemic issues around respectful care and how to ensure that respectful care trickles down from the senior management down to the staff on the wards and on the floors. But basically, with disrespectful care, it has been shown that care, how the staff or how the management treats the staff, or how staff and colleagues treat each other at the workplace, influences how they are going to treat patients when they come into their care. So it's important for us to know that sometimes it's not always our fault, but we just need to be conscious and ensure that we are not knowingly indulging in disrespectful care in our individual levels of care. In some spaces where disrespectful care occurs in a system, an example would be when healthcare workers do not respect themselves. And I think the most common ones is when there's a doctor, nurse, midwife friction. That's usually the very common one globally, where there's a form of disrespect both ways. Examples that I've heard for, or I've even experienced some, is sometimes maybe midwives or nurses disrespect maybe junior doctors, and sometimes it can even be the junior doctors disrespecting the midwives or the nurses, or senior consultants or doctors disrespecting even junior doctors. And like I said, it's vice versa. It doesn't really mean like it's one way, it's both ways. So it can be top bottom or bottom to the top in terms of disrespect. And things like that always reflect in the kind of care that we give. So if a system is perpetrating disrespectful care to the staff, it's important that it's being addressed on a systemic level. But for this presentation, it's basically bringing our awareness as healthcare workers to be able to provide respectful care on our own individual levels, and how we can identify the things that we do. And if we see things which we will discuss further down the presentation, that has been created due to the system, if we're aware of it on an individual level, then we are able to ask questions and challenge the reason why these things are happening. So what are the components of disrespectful maternal care? Undignified care is not only practiced by providers, it's the whole system, and it can enable undignified care. So there are 7 major components of disrespectful care: physical and verbal abuse, non-consented care, non-dignified care, discrimination, abandonment or neglect, detention, non-confidential care, and passive disrespect. Now let's start from the first one. So physical or verbal abuse, basically it's things like pinching, slapping, pushing, and beating women, stitching women, an episiotomy of stitching women up without anesthesia, very painful, and that's physical abuse. Having when women have female genital mutilation, I do not believe this is common in Myanmar. It's common in different countries, but it's where the perineal region, depending on the type of FGM that has been done, is being cut and stitched up. So the clitoris can be cut off. Sometimes the whole vaginal area that is being cut off. So it just depends on the type of FGM. So, but sometimes, in some countries, we've seen where women that have FGM during labor, after they've had their babies, they restitch the FGM, and it's really, really painful because, first of all, the initial cutting has caused a lot of scarring, and then during birth, they are very prone to um, big third-degree tears, and then after having those tears, then they restitch the FGM scars again instead of leaving it to be defibrillated. Also, rape can occur. It's not an isolated situation, but it does occur sometimes, or inappropriate touching during examinations, like genitals or thighs. Also, in the form of verbal abuse, insulting or saying very disrespectful things to women during labor is a form of abuse, basically. So one has to be respectful at all time during care. Next is non-consented care. This involves basically going to a woman, not explaining the kind of medical procedure that needs to be done, and then going ahead with it. So the woman doesn't even have a good understanding of what needs to be done. And an everyday example would be vaginal examinations. No, even though we know, or in our practice, what is expected of us is to do 4-hourly vaginal examinations. It is important that you have to tell the woman every time when you're about to do vaginal examinations, and let her know and reassure her this is what you're about to do and this is why you're checking. And it's left for her to consent to that or not. Non-dignified care is use of non-dignified language or speaking rudely, like threatening the woman. This is very similar to verbal abuse as well. And if did not, so example, if you don't cooperate, I'll take it to theater. I've had cases like that as well that I've seen. There's a failure to provide services due to personal values, failure to explain nature of procedure examinations, and the body is exposed unnecessarily. So where we're providing care to women, it's important that we try to cover them up as much as possible. Sometimes we can just get carried away and think, oh, I mean, she's in the hospital, she expects that we will need to do a lot of things. It still doesn't matter. Even when you're going to have to do a vaginal examination, try to make them feel as dignified as possible. If it's that you just cover up the areas you do not need to see or does not need to be exposed, just cover it up and then do your vaginal examination because it makes them more comfortable. Sometimes there can be people around as well in their care. And this can give me 1 minute. Hello, I have started the webinar already, so I'm recording, so I'm just gonna quickly just go back and just recap like what I've said. So we're talking about respectful maternal care today, and It's basically ensuring that women receive adequate care that maintains their dignity, privacy, and confidentiality, and ensures they are free from harm and mistreatment, and enables informed choice and continuous support during labor. And with respectful maternal care, there's the other side to it, which is the disrespectful care. And disrespectful maternal care is basically involves when one is providing undignified care or disrespect during care. And undignified is lacking dignity or value for someone. Disrespect is rude conduct and usually considered to indicate a lack of respect. So there are 7 components of disrespectful care, and that's physical abuse. And I'm going through all of the components of disrespectful care now. So the first one is physical abuse and physical abuse or verbal abuse, which involves pinching, slapping, pushing, and beating, stitching women's episiotomy or tears up with anesthesia, restitching, female genital mutilation, scars, or inappropriate touching during examinations. Non-consented care is basically doing procedures without explaining properly to the women. And that's as simple as a vaginal examination. You want to carry out a vaginal examination and you do not ask the women for consent. You have to gain consent, explain to them what exactly that you're doing, so they are very much aware of what you're about to do. So the next one is non-dignified care. Is the use of non-dignified language or speaking rudely, such as giving out threats. So an example that I've seen is I've heard people say, if you don't cooperate, I'll take you down to the theater, like a threat, especially because they know that the woman is not interested in going to the theater. So to get the woman to do what they want, they then say, if you do not cooperate, I'll take you to the theater. Another example is failure to provide services due to personal values. So sometimes care workers might not want to provide a service due to personal values, and they will withhold that service rather than discussing with the management how to go about it to ensure that this woman gets adequate care. They withhold such services. Another is failure to explain nature of procedure or examination, and also unnecessary exposure of a woman's body in labor care. So a lot of times we find that because of how the word is how vulnerable women are during labor, they do feel undignified in their care when they're with us, because sometimes they find that their bodies are exposed unnecessarily. So it's very important that we ensure that they're covered as much as possible. I've seen cases where other health workers are coming into the room and then we just forget ourselves, and these women quickly try to scramble to get clothes to cover up themselves, because obviously this person coming into their space is new and hasn't seen them. So it's important that we try to protect our women's dignity as much as possible. Another one is unhygienic conditions, like no change of linen, women asked to clean delivery couches by themselves, dirty toilets and bathrooms. Another component of disrespectful care is discrimination. So things like, for example, if a woman has an infectious disease like such as HIV, and it's so clearly marked on the woman's record, it's a form of discrimination. Then another example is limiting vaginal examinations for this kind of clients. There is really no rationale to why the examinations are being limited. is basically to use the adequate and protective equipment to ensure that you provide the service, except if the woman doesn't consent to it, then there is no rationale to why limiting an examination is being done. Another example is denial of services due to lack of money and poverty, which with my work experience, I have seen a lot of women say that they've been denied services because of how they look or how they have been perceived by the healthcare workers. And they also say sometimes the healthcare workers do not treat them appropriately. So they do not even want to access services in those healthcare centers. So denying services due to that is a form of disrespectful care, is discrimination. Abandonment and neglect, delay in receiving care after a decision has been made. Example, to perform a C-section, if there's unnecessarily delay without a proper explanation of why there's a delay in the section, then it's abandonment and neglect. Failure to stitch an episiotomy in time, failure to offer services even when staffing is adequate, failure to examine clients according to national guidelines, even when the resources are available. And a lot of times, neglect post-delivery is quite common as well when women have had their babies, because they do not always require that one-to-one care anymore. Sometimes neglect and abandonment can occur. So on an individual level, we just have to be very aware and conscious of these things that can cause us to perpetrate disrespectful care on an individual level. Detention, retaining is another form of disrespectful maternal care, which is retaining a mother in the facility when she's unable to pay. I've experienced this, and I would say this sometimes can be more on a systemic level rather than on an individual level. But I would also say that it's important that if this is something that has happened in our facility, we need to ask questions just to help the facility rethink how to ensure that women are able to pay, or to rethink what can be done rather than detaining women in the facilities. Now, next one is non-confidential care. And it's basically asking or providing clients with information in the presence of others. So it's important that no matter what, if we need to respect the patient's idea or patient's confidentiality in terms of who they want to be aware of their health condition, or who they want to be aware of whatever is going on with them regarding their health. So, for example, I have seen cases of where women in labor do not want certain information about their past medical history to be disclosed in front of a partner. So they let us know ahead of time, and we make sure not to disclose that information when that partner is there. Even if we have to ask the woman about that information, we ensure to do it away from that partner. And this is ensuring that confidential care is maintained for this woman, because it's her information and she has the power to decide who has access to that information and who needs to hear what. So when we are not conscious of confidentiality with patients, it is a form of disrespectful care. So we need to ensure, and sometimes even our fellow colleagues and healthcare workers if they do not need to know the medical condition of a patient we are caring for, then we do not need to share that information with them, because that is also a form of non-confidential care. I know a lot of times we get tempted to like discuss a case with a colleague if there is no rationale, such as shared confidentiality. If it's not a case of shared confidentiality, then it's not encouraged to share information about a patient to other people, except this woman has consented to it. Now, the other side, or the flip side to disrespectful care, is actually now respectful care. And the question we should ask is, what does I have mentioned like all the forms of disrespectful care. I've picked all the things that would seem like the bad things that we do as healthcare workers. But it's important for us to also identify what respectful care looks like, so that we can imbibe that and also be aware of the things that we have done in our everyday practice in terms of providing respectful care. So the first one is, so we have freedom from abuse and violence. We have consent, privacy, communication, and shared decision making centered around the birthing person, dignity and respect, safety and justice. Now, some of these things I have mentioned while talking about disrespectful care, the components of disrespectful care. So now I'm just going to talk us through what respectful care looks like. So, first of all, women have the right to freedom from abuse and violence. So, if you remember physical abuse and verbal abuse, then this is the opposite of that. So, women have freedom from abuse and violence. So, we shouldn't be hitting women in labor, we shouldn't be slapping them. We shouldn't be giving them threats or telling them if they don't do this, then we need to do this to them, because it's not ideal. So basically, we should ensure that they do not experience any violence during care, whether physical or verbal abuse. Then consent. We need to ensure that we obtain consent from the woman at every procedure and thing we need to do. So for example, a way that this might occur is you're with a woman in labor continuously for the whole day, ensuring that every time you want to do like a vaginal examination, maybe you want to do vital signs, we always ask and say, can I please do your vital signs now? We're due for another one. We advise that we do every 1 hour, every 2 hours, or I would like us to, it's time for us to do a vaginal examination. Are you happy for me to have the vaginal examination done? Sometimes you'll be surprised that some of the women will ask you and say, oh, why are we doing a vaginal examination again? That we just did one. And then you can now say, oh, it's been 4 hours. And we just do it to try to see progress of care or to see progress in labor. So things like that also ensures that the woman feels like she's in charge. She's in charge. She has power in our care, and she's been consented at every point. So a lot of times, little things like this actually make a whole lot of difference in the quality of care we give, or how women perceive the kind of care that we have given to them. Now, the next one is privacy. So privacy, like I mentioned when we're talking about undignified care, is ensuring that we maintain this woman's privacy as much as possible. When women labor or in the hospitals, they're in a very vulnerable space. And what this means is, sorry, give me 1 minute. Just making sure nobody's trying to come in. So what this means is ensuring that if our body doesn't need to be unnecessarily exposed, then we do not need to expose our body. Offer encourage women to wear clothes. Sometimes they think they need to be naked in labor, but they don't need to. So try to help them to maintain their dignity. If there's gonna be a new person coming into maybe a labor room that needs to maybe say the obstetrician, then it's important to let the obstetricians know that she needs to be dressed. So give us a minute, and that's fine. And the woman would really appreciate that. If she doesn't need to be unnecessarily exposed, then she doesn't need to be exposed. So we need to maintain their privacy. Also, I've seen cases in where labor rooms are shared with women. So another in that area as well, you can have different women, 2 women, 3 women, 4 women in the same labor room, birthing at the same time. We need to ensure that we maintain privacy. It can be as simple as making sure we section the rooms and ensuring that each person has like their own space to labor freely and comfortably. Next one is communication and shared decision making around the birthing person. So it's ensuring that we speak to these women, talk to them, discuss with them what the plan of care is, let them know this is what we're gonna do, and this is what we think the outcome will be, and so that they can have enough information to make a decision around their care. So communicate effectively at every point. Oh, I need to do this, I need to change that. And so they feel like they're part of their labor process because it is their labor process. So we need to ensure that we are not shifting that power away from the women to us. It can be quite tempting for us as healthcare workers to want to be in control, be in charge of the betting room. I know that's what we get told. But there's boundaries to being in charge of the betting room. There's boundaries to what we're supposed to do. We have to make sure that we are working with these women to ensure that they're making the right decisions about their care with them, not for them. We cannot make decisions for them. We need to make decisions with them. Next component is dignity and respect. Making sure that we're respectful in how we have conversations with them, talk to them, make sure they feel very dignified. This is where I will say, because sometimes I would not deny the human factor that our environment or the things that are going on around us can make us, will I say, very snappy, very irritable, very annoyed. It's just very important that we're able to manage our emotions and also be aware of it, because sometimes we're not aware and we don't know that we're quite irritable. So it's important for us, and sometimes we're just really tired, which is allowed, but it's just for us to be aware that this is our emotional state at the moment, and this is how it can influence the care we give, and try to see if we can adjust ourselves based on that. Safety, just ensuring that the labor room is safe, allowing the woman to decide and dictate the tone and how the mood of the room should be, gives her a sense of psychological safety, makes her feel very comfortable, makes her feel like it's a space, makes her feel like, okay, she can be safe here. Sometimes I've heard women, a lot of times women do not say it, but I've heard women tell me things like, oh, I feel safe here today. I feel safe. Oh, I trust you. I trust this person. I trust this person to take care of me in labor. And it just creates that sense of psychological safety for patients. So it's important that we create that for them. Sorry about that. And then the last component, my bad, is justice. Ensuring that we provide proper care that is equal we cannot be biased in the kind of care that we give. So an example of what this will be like in respectful care is discrimination. When we discriminate women based on their looks, based on their health conditions, or based on anything that they have, it's a form of discrimination, and it's important that our care provides justice. Our care is just, our care is equal, provides equality, equity to these women. So we must make sure that we do not use our biases or the things that these women have to limit or to dictate the kind of care we give when it's not evidence-based. It has to be evidence-based to do anything. So now, what are the effects of disrespectful care? So with all these things we've discussed, it does have a ripple effect on women, on how they perceive the care that we give and how they feel about the care. So first of all, it's fear and anxiety. A lot of women are already scared of the hospitals in itself. So that's why a lot of women are very skeptical about hospitals. So disrespectful care has been shown to be one of the things that causes women to be disrespectful. Women say things like, oh, my previous labor, oh, the everybody was so rude to me. It's just giving me anxiety. What that midwife said to me was very awful. She made me so scared about my baby dying and different things like that. You will be surprised the kind of things that we do and we think is normal, but for these women brings a lot of fear and anxiety. So that's why we must be very aware and ensure that we are conscious of the things we say and how we say it to these women. Causes emotional distress for women. I know that I've seen a woman that said she didn't want to bet in the hospital anymore because the last time things that were said to her were very awful. And then she was physically abused in labor as well. So she was so emotionally distressed about the whole thing that it made her so fear and anxiety again. Made her very anxious going to the hospital. She was so scared for what would happen again during labor and things like that. So the things we do really does goes a long way to affect how these women feel about labor. Now there's also erosion of trust. Women, as I've seen a study, or there's a study that shows that disrespectful care is one of the major things that causes women to not trust healthcare workers, and especially in the hospital. And this study was showing that that was why they prefer the traditional birth attendants, because they believe that the traditional birth attendants, or the kind of care the traditional birth attendants provided to them, was so respectful, and they trusted the traditional birth attendants to give them care that they did not think the healthcare workers could give to them. So it's important that we provide respectful care to these women so that they can trust in us to provide their care. I feel very comfortable with us. Physical harm as well due to disrespectful care. And one of the major, so that study that I saw as well showed a reduction in the use of healthcare services in that area, because women believed if they went into, so because of the effect of one healthcare worker, it has been established that we're not going to go to that hospital, because now they think that it's everything and everyone associated with that hospital that has caused them emotional distress or their fear or anxiety. So disrespectful care goes a long way, even in affecting how women utilize our healthcare services, especially if we're encouraging women to use skilled birth attendants or to get care in the right place. We must ensure that we provide this respectful care, because if they think they will be disrespected, if they think they're not going to get dignified care, if they think that they would be abused physically or verbally, then they would rather avoid. There's no point avoiding. I mean, even for us as individuals, if someone disrespects us, we usually would avoid them. So that means it's gonna affect how they take up skilled healthcare worker services, or how they take up care in the hospitals or healthcare centers. So in order for us to be able to say, oh, we want to improve maternal mortality or child mortality, we want to improve the numbers, we need to ensure that these women access skilled birth workers. And for them to access skilled birth workers, we need to ensure that we're providing respectful care so that we do not erode the trust that they would have in us to be able to provide for them. So now, in our everyday practice, what would RMC look like? Well, that's respectful maternal care. What would it look like? Evidence-based care, carrying interventions when absolutely necessary, listening to women, practicing empathy, caring for the carer. So respect their rights, ensure strict hygiene, promote breastfeeding, empowering the patient. So these are like the simple things that our respectful maternal care would look like in our practice. Some of the things, not everything, but so like evidence-based care, ensuring that you only do things when it's absolutely necessary. Example, vaginal examinations, if you do not need to do it, if the woman does not look like she is going to the second stage, then there is absolutely no reason to do the vaginal examination earlier than the 4 hours as indicated. No reason. You're just making the woman more prone to infections. We have to listen to women. If a woman says, I have found that listening to women has greatly helped me in practice as a midwife. I've had women say, oh, I do not feel right. And physically, our vital signs, everything shows nothing. It's all good, nothing, all clear. But then she kept saying, because I had just done the vital signs like a few hours ago, or like a few minutes ago, rather. And then she said, oh, I do not feel right. And I said, you do not show any physical signs, but I'm just going to check this for you again. And just to be sure that, just to give you a bit of reassurance that you're all right. And to my greatest surprise, I did it. And then this woman was actually very right. It just crept in the last minute. So it's important that we listen to women, practice empathy, not sympathy. Ask ourselves, if we were in this woman's shoes, how would we feel? How would we want to be treated? How would we want to be spoken to? How would we want our care to be? And it really does help me. It's why I can empathize with people in pain. I can empathize with women in labor and say, okay, let's do it this way. So care for the carer. And this really relates to someone in a senior position in terms of, and not even just in a senior position, I'll say even to ourselves as colleagues in healthcare, it's important that we care for ourselves. So what, like I mentioned earlier when I started the presentation, if the system in itself perpetuates disrespect to the staff, or it's a case where the staff are disrespectful to each other, then it's quite easy for the staff in itself to perpetrate disrespectful care to the patient. So it's important that the managers, the senior leadership and colleagues to colleagues are respectful to themselves, because when someone disrespects us, it puts us in a very awful place and mood mentally. And what that means is that when we see somebody else, without us realizing, subconsciously, we then sometimes transfer that aggression or our grievance onto them. So it's important that staffing, or we as nurses at the workplace, feel psychologically safe, feel respected at work, and feel like we're heard and listened to. And that's actually evolves into how we speak, interact, and relate with patients in labor. So it's important that senior leadership is able to care for who is caring for the women. We need to respect their rights. If a woman says no, a no is no. If a woman says yes, yes is yes. even in a case where we do not think on an individual level she's making the right decision, or even on a medical level she's making the right decision, we still need to respect their rights to decline care or to accept care. So respecting their rights, ensuring hygiene, always no dirty bathrooms, make sure that the beds are clean, change linens, and promoting breastfeeding as well. No discrimination in care. Ensuring that even though we promote breastfeeding, we still need to respect woman's decision about how she wants to feed the baby as well. And then lastly, empowering patients. We must not be tempted as healthcare workers to shift the power from the women to us. We must ensure that they are in charge of their space in labor. They are doing everything that they want to do and they feel very comfortable. It gives them a sense of control, gives them a sense of psychological safety, it gives them a sense of they're being listened to, and it reassures them. And once they feel reassured, they feel good, they feel safe. What then happens is that it allows them to labor properly. All the oxytocin is released, they can labor and go through labor properly. Or like when they're very anxious and then we're getting all the adrenaline, which we do not want because it contracts all their muscles and then they're not making progress in labor. But with the oxytocin, muscles relax, they're very happy, feel psychological safe, all the endorphins are being released, and then they labor as they can, labor comfortable, they're able to manage their pain in labor, and it just makes the labor process a whole wonderful experience for the woman, basically. So that is what respectful maternal care is about. Ensuring that these women are respected, receive adequate care, make sure they're in charge, they're empowered, and they would always be happy with the care that is being received. If you have any questions, please let me know. That's the end of this webinar topic. So if you have any questions, okay, so I believe no questions. I believe no questions. I'm just gonna share a link on the group now for a post test. So please feel free to share to fill it in. Whatever, if you still want to ask questions, you can ask on the group. I'm happy to respond anytime. Thank you very much for joining. I really, really appreciate it. Thank you. Have a lovely day.